Right now, mental health is on the mind of many people across the country. On top of the pandemic, we've had several major headlines recently.
10 TV's Ashley Bernanson is asking medical professionals how you can take care of yourself as people look for ways to cope. Ashley?
Yolanda, Andrew, local mental health professionals tell me many people throughout our country are processing recent events in different ways. Some are experiencing what they call lived trauma. Others, it is vicarious trauma. But as a whole, the professionals say most people are going through what's called moral injury. That's when how they thought the world should behave is not the reality. The important thing is that they say is to understand that you're not alone and that there are tools to help.
It's like you can't trust me to make the choice for my own body, but you can trust me to raise a child.
Abigail Houston says the overturn of Roe v. Wade leaves her in fear of what this could mean for her future.
And just like a lot of tears and fear, what do I do? Do I get on birth control even though it was really hard on my body?
Felicity Neal says protesting helps her feel like she's making an impact.
As a woman of color, and then having Roe v. Wade overturned and also Black Lives Matter going on, it just feels like there's no space for me in the world, I guess.
So does Tara Weld, who walks beside her son and family.
As somebody who has had a miscarriage in the past and had to go through a medical abortion, it's really scary to think that there may not be that healthcare out there here locally if anything were to happen with our pregnancy.
All three of these women are going through their own type of trauma. Ariana Gallagher says everyone is handling these recent events differently based on how they relate to the events. She's the associate director of the Star Trauma Recovery Center at OSU Wexner Medical Center.
For a lot of people, it's sort of an existential dread. A lot of questioning, what does this mean?
She recommends speaking to a counselor and exploring ways on what action you can take.
How do you want to spend your energy pushing for the outcomes that you would prefer to see, that you think would make a positive difference in the world?
Your feelings of being unsure is justified. And it is normal.
Faith Walters, a licensed social worker and trauma professional, says signs of trauma experience include trouble falling asleep and waking up, nightmares, disassociation, like spending hours watching TV or playing video games, struggles with emotional regulation.
Like being very angry, angry outbursts, yelling, screaming, throwing things. Sometimes it is just crying and you cannot identify that one thing that has you so tearful and emotionally upset.
And practicing mindfulness 15 to 20 minutes a day. Abigail Houston says she's taking some of these tips to heart.
I have really good friends. We all try to be very emotionally intuitive and intelligent, and we're like each other's support system.
Now, Walters tells me that mindfulness could be just sitting in your emotions for 10, 15 minutes a day and acknowledging that they are there, but they won't be there forever. Things will get better day by day, especially with some support from some mental health professionals. Yolanda, Andrew.
Great reminders, Ashley. Thanks so much.